Hey guys, this is Curtis Alexander. In this video, I'm going to be covering the side effects that we can see from Ajovy. I wanted to make this video because if you look at the literature and the studies, there's only 2 or 3 side effects listed for Ajovy, but when a drug hits the marketplace, we can see reports, aftermarket reports of side effects. I get a lot of questions on those particular side effects, so I want to spend some time covering those as well. So first and foremost, do we see what are the most common side effects with Ajovy? Number one, by far and away, is going to be injection site reactions. So when you inject in the upper thigh or the abdomen area, it can get a little red, a little raised. It tends to be temporary, sticks around maybe a day up to 3 to 4 days, goes away. For some people, it will happen for a few more months when they do their monthly injection. Other people, it happens once, they don't see it again. Okay. Antibody development. Anytime with any of these injectables in this class, you run the risk of this happening. It's not a high percentage, 1 to 2% of people, but the body essentially develops antibodies to Ajovy and can make it less effective. So that's what we're concerned about. Now, hypersensitivity isn't a common side effect, so I don't want to confuse anybody, but I list it there because it's something we commonly warn people about, that listen, any medication you can take, you can get a hypersensitivity or allergic reaction. Ajovy is no different. Now, what about these side effects that we see after a drug's hit the market? People are reporting these things. Have I seen it? Have there been any aftermarket studies? What are people saying about these side effects? So here's what I've found and what I've seen. So people are reporting weight gain or bloating. By the way, all these side effects in this group, I'd say 5% or less of people experience these. I've seen reports of weight gain and bloating. It's not severe. It's not like you gain 40 pounds if you're a 150-pound woman, but people have reported weight gain, again, less than 5% of folks. Fatigue has been reported. That one's even a little less, maybe 3 or 4%. Now, I want to point out that some of the aftermarket studies that they are seeing some of these things and some of the reports, the percentages are not set in concrete, okay? So just keep that in mind. We have seen reports of depression. It tends to be mild, and it can also be related to, sometimes people will take Ajovy and it doesn't work that well for them, so they get depressed if they're on this medication. It's supposed to help. It's not doing the trick, so there's that component as well. Hair loss also been reported. Again, not common, but it is something that you want to be aware of. Withdrawal is not something that's going to happen. People get confused. If you were to start Ajovy this month and next month, just not take it, go off it, you're not going to get withdrawal. What you may get is a bump up in migraine frequency for a short-term basis, but not withdrawal. Finally, constipation. I have seen this personally. It's very rare. I would say roughly 1% of users should be worried about constipation. However, in this class of drugs, if you see constipation, it does tend to be severe and they have to go off the drug, move to something else. Okay. What I would like from you is let me know in the comments, have you taken Ajovy? Do you know somebody else who has? Did you see any of these side effects? It's helpful for the other viewers. It's helpful for me. Okay, so let me know in the comments. And speaking of helpful, I hope this was helpful, and I'll see you in the next one. Thanks.